Health news tonight, there were 456 drug overdose deaths involving opioids in Utah back in 2017. Our state also has a rate of 15.5 opioid deaths for every 100,000 people. Now compare that to the national rate of 14.6 deaths for every 100,000 people. Now research is connecting opioids to heart disease. Sarah Martin explains.
According to the CDC, drug overdose deaths have increased significantly in recent years. This rise in drug abuse brings an increased risk of a serious and potentially fatal infection of the heart valves. New research led by Cleveland Clinic's Dr. Serge Harb shows an alarming rise in this type of infection in young people who abuse drugs.
Between 2002 and 2016, nationwide hospitalizations for infection of the heart valves related to drug abuse have nearly doubled, from 8% to 16%. And this has affected the entire nation, with the Midwest being the region most affected.
Dr. Harb and his colleagues studied millions of hospitalizations from across the country between 2002 and 2016. Results show a rise in admissions for infection of heart valves called endocarditis, particularly among people who have a history of drug abuse. According to Dr. Harb, this type of infection can occur in people who use injectable drugs, when bacteria gets into the bloodstream from a dirty needle or from opiates contaminated with foreign substances. Data shows infection of the heart valves related to drug abuse significantly affects young people, with the average age being about 38. The study also shows approximately 68% of people affected were Caucasians, 55% were men, and 42% were from low-income households. Many also had HIV, hepatitis C, and suffered from alcohol abuse as well. Dr. Harb says treating heart valve infection involves antibiotics and sometimes surgery, but in order to prevent reoccurrence, he says the addiction needs to be treated too.
Treating the infection is only part of the management plan. The bigger picture is to help these patients, provide them with social support, put them in effective rehab programs, help them with their addictive behaviors so that we can prevent relapses and can help these patients with a better care.
Results also show that people with drug abuse-related heart valve infections typically stay longer in the hospital and incur higher medical costs. Reporting from Salt Lake City, I'm Sarah Martin, ABC4 News.
Thank you, Sarah. Well, just